Good morning, all. This is Dr. Shadi Rapich from Vet Triage. A little bit late start to the morning. That's okay. It's Wednesday, June 19th, 8:19 a.m. Pacific time. And I thought we'll touch on a very straightforward, easy subject, artificial intelligence. No big deal. Just go through it real quick. All right. So, artificial intelligence. So, keep in mind a few things. Number one, um, I'm not an expert with AI at all, and I'm not even really sure I use it. If I do, it's unknowingly. And so I'm going to describe this in sort of a very broad, general sense with my experience with it, and from talking to other folks in the field who are using it, who are leveraging it. So we'll start there and see where the conversation leads us. As always, playback crew, thank you for watching. Please hit like, subscribe, do all the things, and feel free to donate, all that good stuff as well. So AI. So the idea behind artificial intelligence in the medical field is to compile a large amount of data to be able to in order to give the computer the ability to look for trends and then make a conclusion, a medical conclusion. That's the point. And you need a lot of data, and the data needs to be as consistent as possible across the spectrum there. And then the system needs to be able to figure out, okay, after reviewing 5 million of this, we came to the conclusion that when we see this pattern, it's this disease, and this pattern is that disease, something like that. That's my understanding of it. And obviously, artificial intelligence is a powerful tool. So was the internet when it first came out, and it still is powerful. And some would say we didn't direct the front on the internet that responsibly. With all the things that the internet did that was good, might be a bit outshadowed by the things that we did with it that were bad. And so artificial intelligence will probably follow the same trends. I'm a bit skeptical of how we're going to leverage this immense power. But regardless, in the veterinary field, there's two main ways that I've seen it used so far. And I can touch a little bit about the human side too. One way in the veterinary side they've used it is for medical records. So a lot of people now familiar with artificial intelligence being used as a transcriber. So it can transcribe for you live even. So during a meeting or something like that, what people are saying, and with amazing accuracy. And in the veterinary field, it's not enough just to be able to transcribe. It also needs to know medical lingo as well. So a lot of long words, a lot of complicated words. It needs to know those words. And then, but the way the veterinarians are using it are not just for meetings. They're also using it for compiling medical records. So if you're a veterinarian and you've been doing this for a while, you know that a lot of times you spend hours after your shift ends writing up the medical records from that day. I know vets that are behind their medical records for weeks or even months, and it's terrible. And so if you are able to have artificial intelligence transcribe for you, basically you would dictate the medical record, it'll transcribe it, and then you have to just check for any mistakes, check for inaccuracies. And you can do this live. If you're a veterinarian in front of a pet owner in the exam room, you can speak out loud to the device, and it's going to transcribe the conversation you guys had, and then try to compile it to make it legible for your medical records. And it's going to save you a ton of time. I haven't used it myself, but I've heard good things about it. And because we know that artificial intelligence is still in its infancy, this will only get better over time. I have no doubt of that. The second way I've seen artificial intelligence used in veterinary medicine is to read radiographs, so X-rays. And just because I have to, X-rays are the name of the beams that come from the X-ray machine. So X-ray is actually a wavelength of light, right? It's like gamma rays and infrared and the color spectrum. So X-rays are the actual wavelength. Radiographs are the imaging, the images that are generated from the passing of X-rays through the patient's body, and then the machine measures that. So just to be clear on the semantics. So radiographs are what we really mean. Most people use x-rays to mean the actual test itself, which is not accurate. So anyway, so in reading radiographs, artificial intelligence took off immediately, where it's possible to have a million x-rays of a dog in this position with this disease that have been verified by veterinarians, and then take those millions of images and have the system say, okay, well, if it's the dog and it's this position and it's this disease, we now know what it looks like. And so you can just throw the image into the computer, let it spit out a diagnosis in a second, because it has this huge database behind it. And so a lot of veterinarians will use artificial intelligence to interpret radiographs for them. However, downfall of that is it seems like a lot of copy and paste, a lot of templates. So I'll submit radiographs and I'll get back a result that's just a textbook paragraph of all the possible diseases that are potentially present in this pet. Whoa, look at this. Our very first audience member. Oh my goodness. Hitting a live stream live. Sarah, do animals have PHI? Thank you for correcting the semantics between x-rays and radiographs. You're welcome. Please elaborate on what PHI is, and I'll be happy to try and answer it. So I find that a lot of these radiographic interpretations by AI they're just not useful to me. The other part to it also is I'm very confident reading radiographs as a board certified veterinary surgeon. A lot of veterinarians find radiographs difficult to read, as they should, of course. It takes time and experience and training to know how to read them. But if you're not comfortable with your skill set with reading radiographs, and now you're relying on AI, not only does that further weaken your skills as a veterinarian to read radiographs on your own, but it also doesn't let you double check the accuracy of the artificial intelligence interpretation of the radiographs. Or if you had a human radiologist, a human veterinary radiologist look at the radiographs instead of AI, you can't double check their work either. They might be specialists and experts in their field, but they still are prone to errors. So you need to be able, as a veterinarian, read your own radiographs, formulate your own opinion on those radiographs, document that, and then double check your work with the board certified radiologist or the artificial intelligence system you're using, whatever, and see if you agree or if those two things jive. So that's the other way that I've seen AI being used in the field. I know on the human side, cytology and biopsies, for example, are a common use with AI. And I also know that with like mammograms as well for breast cancer, AI is being used a lot. And it's the same idea. You take a whole bunch of mammograms, and these are ones that we as human beings have deemed normal. These are ones that were deemed to have cancer. And then you put those in the machine, and it creates its database to be able to say, okay, now I know what normal looks like. I know what disease looks like. And then you can just submit a mammogram and it pops out an answer. Let's see, Sarah, protected health information. Usually human patients have PHI and individual rights for confidentiality for their healthcare information. So no, animals do not have a PHI. The vet triage platform actually is HIPAA compliant in an effort to be more proactive and to be higher grade than we are in the field currently, in the veterinary field currently. And so with vet triage, we have measures in place to prevent against disinformation going public. And it's not needed. It's not necessary for the field, but I felt it important to exceed what our current minimum standards are. And so we actually do on vet triage acknowledge some formulation of PHI. However, in the veterinary field, no, there's nothing like that. I suspect, I think I know the reasons why. I don't know, but animals are seen to be property. They are not individual beings in the eyes of the law. So you can do whatever you want with your pet. Obviously, we have laws against animal abuse and things like that, but they're not treated the same way in this regard as a human patient would be. There is no confidentiality issues there. We still act as though there is in the vet field, because it makes sense to be able to insist that we protect information, but it's not the same way as is in the human side by any stretch. And I wonder, as the telehealth movement continues to evolve in the veterinary field, if that eventually become a requirement, because cyber leaks and cyber theft and all this stuff, it even affects the largest companies in any space, veterinary included. And you can best believe that eventually some telehealth company will get hacked or whatever, and that information will go. So go vet triage. Our four-legged babies deserve their privacy too. Some people do treat their dogs as humans, as you stated in the prior live stream. Oh, for sure. Yeah, how people take care of their pets is different than how the laws look at it. It's one of the reasons why veterinary medical insurance is the way it is currently. So yeah, no, great points, great question. Thank you so much. So yeah, so as you can see, the use of artificial intelligence is handy. It's useful. It's powerful. It's still in its infancy. I'm not utilizing it myself currently. I imagine eventually I will, in whatever regard. And I'm sure I only touched on a very small fraction of how folks in the veterinary field are utilizing this technology. But my main point is, let's focus on making it as positive and influential in a positive way in the human space and veterinary space as we possibly can. And also, let's not forego our own skills as doctors to be able to check the machine and make sure that what's coming out of the AI is actually accurate and makes sense for that scenario. So just be aware, just like with any other new technology, and make sure that you're skeptical of it. So I think that's probably it for today. Thanks so much, Sarah, for being the very first live audience member. That's wonderful. And everybody else, please, you're welcome to donate, spread the word, hit like, subscribe, all that good stuff. And I'll see you tomorrow, June 20th, for probably a very early live stream, as I am flying out of town tomorrow. So I'll be on pretty early tomorrow morning, and we'll see you then. Thanks so much, everybody. Take care.